The single clerking process for the acute floor was introduced here in February 2016. It improves patient safety. Previously, we had more than 3 places to prescribe drugs. Now everything is prescribed on one drug chart. Prescribing errors are less likely to occur with the new system. It consolidates paperwork. One single clerking form replaces 5 previous performers, which guarantees more consistent clerking and safer documentation. It avoids duplication of clerkings. Previously, A&E junior doctor would clerk, then specialty junior would come and reclerk. Single clerking brings forward senior reviews. Patients will get seen by senior decision makers and get finalised management plans sooner.
But most importantly, single clerking creates teamwork. So we can get better training for our juniors, but most importantly, we can get much better, much faster, much more efficient care for our patients.
The single clerking process is applied to all GP expected and A&E patients, with the exception of the urgent care centre. The process allows any acute floor junior to clerk any patient and present to any senior. Every effort will be made to allocate appropriate patients to appropriate specialty juniors. For example, chest pain to medical, right iliac fossa pain to surgical, undifferentiated patients to A&E. The single clerking process starts with the acute floor team meeting at 9 a.m. It is a quick meeting led by an A&E consultant, during which everyone introduces themselves and staffing issues are identified. This full team meeting leads into quick medical emergency team and trauma team meetings. After the meetings, it is time to find the right patient to clerk.
As one of the A&E SHOs, I think that single clerking is great for not only patients but also doctors. I see patients coming straight off the street, and often I have to initiate plans and I'm not sure really what happens to my patients. Now I find that patients are getting earlier reviews by consultants, which means I get feedback on my clerkings and patients get better care.
So in terms of how single clerking is working for the registrars, to put it simply, it allows us to function as more senior doctors. So we spend our time reviewing the more unwell patients and supporting the juniors. I think it's also helped to break down some of the barriers between the accident and emergency teams and the medical teams, just allowing us to function as one team and to basically all work together more effectively.
When handing over to the wards, the nurses seem much more appreciative of the way that the information is being shared and presented, and it allows for a clearer, more accurate handover.
And finally, for the patients, it means that they're seen by seniors much faster, and I think patients are aware of that. And it also stops some of the unnecessary duplication, which from a patient's perspective can be a bit confusing and can also be uncomfortable if they're being re-examined or re-investigated whilst they're in pain or disorientated.